One of the things we can do is really focus on a patient's insurance. If they happen to have an insurance with a formulary, we can work hard with the physicians to change over to less costly, clinically effective and equal agents that will work just as well as the agent that the patient may be taking, but might be available as a generic, for example, and that's something that we can try to get it changed over to. So that's one option. Sometimes there are no generics available in a class. And in that case, we could try to work with, again, the formulary to evaluate which would be a lower cost option. It may be a brand, but it might be a few dollars cheaper, or it might be a preferred brand on the insurance formulary. And in some cases, what we're able to do is, for example, with the statin medications, your Lipitor, Crestor, some of those that are still available as a brand, if for whatever reason the patient can't take a simvastatin or a pravastatin, a generic equivalent, we can take a higher dose of what the patient's taking, double the dose, and cut it in half. When we do recommend pill splitting, it's always advisable to have a pill cutter device and not to use, your scissors or your knife in the kitchen, because then you don't get an accurate dose. So when you have a pill splitter, typically there's a blade inside, and you would just place your pill in the area that's for the pill, and then you just push down, and then it splits it equally in half, so you get the correct dose each time. Now, when we talk about cutting pills in half to reduce costs, we have to be very cautious that the medications that we choose to do this, that they are able to be split in half without causing any side effects. Sometimes there are medicines that are extended release preparations. These are your XR, your XL. Those types of medications have a special coating. And so if you cut that in half, you lose the extended release properties, and the patient gets the full dose of the medicine right at once, and that can create significant side effects. So before doing or considering any kind of pill splitting for any of your medications, you really need to make sure that it's a medicine that is safe. Other option is we can look into patient assistance programs, a company-sponsored, a pharmacy manufacturer-sponsored programs that will offer maybe a month's supply. If a patient meets certain eligibility criteria, they will send out the medication to the patient's home or to the physician's office. And finally, for a lot of Medicare Part D patients or seniors that have Medicare Part D, we really want to look at if they would qualify for extra help through Social Security. And that's